know that you have been treating top US athletes. How does FSM therapies complement and enhance sports medicine?
Oh, it enhances sports medicine by doing the impossible. There's no other way to put it. There is a phenomenon that we observed, I think the first time in 1998, when a patient came in to be treated. She had an auto accident. She was a ballerina, which is a different kind of athlete. And the accident was at 8:30 in the morning, and I treated her from 12:30 until 3 o'clock. I treated her from 12:30 to 2, and then my assistant treated her from 2 to 3. And at the end of the treatment, and we ran frequencies to stop bleeding and treat the tissue for being torn and broken and removing the trauma from the tissue. And I told her at 3 o'clock to go home and use ice, take an anti-inflammatory medication. It would take 4 months to recover. She would not dance. She was a ballerina with the Portland Ballet. She would not dance for 2, maybe 3 months. And I also told her that the pain would be worse the next day than it was today. And the next day she came in completely pain-free with full range of motion. And she was dancing on Monday. That's a good face. Yes, it was like, okay, I'll come in on Monday, maybe it'll be worse.
Miracles.
It was incomprehensible, literally, at the time. And since then, we've replicated that in athletes all over the world with professional football teams, golf, basketball, baseball, hockey. It works on horses. We have 2 levers that are of tremendous, well, 3 actually, of tremendous assistance when you're treating sports. One is healing new injuries. Competitive athletes push their body until it breaks. Then they need it fixed, and they need it fixed quickly. So the story of the lady with the auto accident, as soon as they get injured, they either come to their therapist, or we have units in the US that they can use at home that are programmed for new injuries, and they treat themselves right away. So then the rehab proceeds over 3 or 4 or 5 days instead of 3 or 4 or 5 weeks. So it really shortens the repair time. Then in between competitions or in between seasons, the biggest impairment to coordination and speed and precision, depending on what your sport is, are adhesions between the nerves and the fascia. The fascia has to glide. If you're a quarterback or a baseball pitcher, every muscle between your pelvis and your fingers has to move freely and smoothly. If there's been an injury at all and the nerve is adhered, that coordination suffers, so does speed. So we have frequencies that treat nerves and dissolve scar tissue between nerves. And then in the last, I would say, 10 years, we have the ability, we have frequencies for different parts of the brain, and frequencies that appear to manipulate or stimulate those parts of the brain directly. So when you, let's say a baseball pitcher, you now, he's had an injury, or just he's been pitching for 3 years, and so this area is tight. Stiff. So you release the adhesions, you get his arm loose, but the muscles now, because they are completely different than they were 50 minutes ago, the brain doesn't know what to do with them. It has to rewire the brain's connection to the arm. So phase 3 of FSM sports is the neurologic reprogramming. So there are frequencies for the motor centers, there are frequencies for the cerebellum. You increase the frequencies are increase secretions in the cerebellum. Then you have him do the movement to throw the baseball while you're running the frequencies to make the cerebellum coordinate all the muscles he wants to move, he needs to move. And in 5 minutes, at first he starts out uncoordinated because nothing is where it was an hour ago. And in 5 minutes, that's now smooth. But there's another step, and that is to reconnect these muscles to the sensory and motor cortex. So the cerebellum coordinates movement, the sensory and motor cortex initiates movement. So this fires, it sends a signal in a millisecond to the cerebellum, which then stimulates the muscles to fire in coordination, but both have to work. So you treat the periphery, then you treat the cerebellum to increase coordination, and then you treat the sensory and motor cortex, and then back to the cerebellum and back to the periphery. So being able to address it, not only to repair the injuries, that has turned out to be easy. Fractures, if you can get the fracture within 6 weeks of the time, if you can get to the fracture and treat it within 4 hours, and this is assuming it's a fairly simple fracture. If you can treat it within 4 hours of the time of the original injury, they seem to heal in 3 weeks instead of 6. It changes, the only thing we can think of is it changes the genetic coordination of repair. So treat new injuries in half the time or less. It's like they never set up. And then repair old injuries and then use the frequencies to coordinate neurologic function. And the other piece is harder to talk about because athletes, every professional athlete I've ever met, they don't talk about emotions. They don't have emotions. If there's something happening at home or in their private life or in their professional life that they're upset about, they don't talk about it. So there are frequencies for specific emotional states, for the parts of the brain that get distressed, and they don't have to talk about it. So you just take a guess. It's like, this guy is really afraid of getting hurt again. So you run the frequencies to change the pattern of fear and anger or hurt feelings or whatever. And his performance changes because he's more at ease in his body.
So basically, you treat him physically, but you treat him also emotionally and mentally. So it's like a 720 degrees.
720 degrees, exactly. And the nice thing is, they don't have to talk about it. The current is current you can't feel, and we never tell them what we're running. So the changes that we make with the frequencies, they just know they feel better. And that's what's important.
Exactly.
That's what's important.
Exactly. We are living in a rather increasingly toxic environment.
Mm-hmm.
Air, food, water, many social media messages, digital screens all over the place. Mm-hmm. How does frequency specific microcurrent helps us to detox and reset our cells and our body?
That's a really good question.
Physically, mentally, and emotionally.
Yeah, that's a really good question. So there are frequencies on this list for toxins. General toxins, 57, and the two most common organic toxins. There are other frequencies for poisons that are less generally useful but very specific sometimes. And when you think about toxins that you take in or surrounded by, the problem with toxins is that they are, if the liver can't handle them the first time the blood goes through the liver, if it can't detoxify, the liver takes it apart. Well, this chemical comes through your liver and the liver says, I'm sorry, we're busy, I come back later, I'll see you in, an hour. Well, that toxin floats around, and as it goes through the circulation, it will find, like a puzzle piece, it finds a place to land.
Yeah.
Where it embeds itself in the membrane. Let's say in your bronchi,
mm-hmm.
right? Or your digestive system. And it embeds itself there. And every cell in your body has got this cell membrane, even the ones in your colon, the ones in your liver, the ones in everything. Immune system has a cell membrane. It's made up of fat and proteins, and they have little protein antennas, receptors. And those receptors are connected to pieces inside the cell that control the genes inside the cell. So the problem with the toxin is it lands next to this antenna, and because the toxin is heavy, charged, different, the antenna literally, chemically, electrically gets pulled out of position. Okay. Now, when this is out of position, it tells the inside of the cell to do something different than it's supposed to do, because this antenna is supposed to be here, and instead it's there. And that changes the wiring in the cell. So, over time, all these membranes get replaced. So now this little piece of toxin goes floating off to the liver and gets taken apart. Now the liver has time. It says, okay, I can take you now. Takes it apart, you excrete it. And when the cell replaces itself, the antenna is still in the wrong position. So I think what the frequencies do is reset, that's your word, reset the antenna to its more normal position. So treating patients who have been exposed to organic chemicals and toxins, the frequencies are a tremendous help after surgeries for treating the brain and different parts of the brain, for like brain fog and the difficulties people have after surgical procedures that involve anesthesia, or if somebody is working in a toxic environment or just has a toxic exposure when somebody sprays whatever on the lawn next door. They get maybe headaches, or they have trouble thinking straight, or they are fatigued, or now they're anxious or depressed, or their stomach doesn't feel right, or something. So we use the frequencies to reset the antenna, and almost every toxic exposure results in inflammation. Inflammation is the body's number one defense about everything.
Yes.
I don't know. Let's inflame it, see if we can get rid of it. So we have frequencies to reduce inflammation that we have great data about. So you treat the toxicity, you treat the inflammation, but then you have to help the liver, because now all of this is starting to come out. You have to help the liver. So that's where nutritional approaches and functional medicine approaches and integrative medicine approaches come in handy. So there are herbs that help the liver to work better. Milk thistle, and there are nutrients like lipoic acid and coenzyme Q10 and methylated B vitamins that help the liver. So helping someone detoxify and reset has become a matter of, I would say, weeks, 4 weeks, 6 weeks, instead of 6 to 12 months. It's just not that hard. And in the last 22 years, it's as if I've done things that even I don't believe. So you have a number of cases, and they're all successful. And they are so literally, they appear so literally miraculous that it's a little difficult to get your head around it. So they're on a shelf, they're on a list, and now we have, 3,000-4,000 practitioners around the world in 23 countries. And they have the same experience. Toxicity, that's easy. You do this, you do that, you give them that, what's the problem? So, it's really an important tool because it makes the process so fast. You can do it with saunas and nutrition and IVs and all of that, and just push the body to get rid of the toxin from the liver. But resetting the antenna is not something you can do with nutrition and IVs and saunas. You get rid of the toxins, but it's the antenna that's the problem. We can help with the antenna.
Beautiful answer. Beautiful answer. And I think it's very, very helpful for everybody seeing us to understand the complexity of the process of detoxification and resetting the cell functioning and body functioning.
And it's a lot easier for a patient to commit to the detoxification process when they know it's 6 weeks. You can do anything for 6 weeks.
Yes.
When you're talking about 6 months,
oh,
that's a whole different ballgame, and maybe you'll feel better. But the nice thing with the frequencies is that they feel better right away. And then the process is more or less complete in 4 to 6 weeks. So it makes it much easier on the patient, easier to afford, makes it more efficient. One of our watchwords is it's more efficient, more effective, and less expensive.
Absolutely.
Yeah.
In all respects.
Yeah.
To wrap up our conversation, I will ask my last question to you related to top 5 recommendations to live a healthy, vibrant life.
Oh my. Top 5 to lead a healthy, vibrant life. Honestly, really, the first one is to begin to see yourself as living a healthy, vibrant life. That is who you are, and this inconvenient thing that you're dealing with is not who you are. I had a patient who had rheumatoid arthritis, and she said, I have rheumatoid arthritis. It is not who I am. And she improved, she got better. So that's the first part, is an internal decision for the patient to see themselves as healthy and to commit to doing what it takes to make that real. The second thing has to be in my mind is frequency-specific microcurrent. I have used it for 22 years. I use it every night for something. I'm 73. I lead a very busy, difficult life. I've had a lot of injuries that just sort of happened. I had very good care. And I guess that would be the third thing. So see yourself as healthy. Use frequency-specific microcurrent. Keep looking until you find a practitioner that says, I can help you. And that there have been 3 or 4 people in my life in the last 25 years that have saved my life. Wow. That way. You asked for 5. What's the other one? Listen to your body when it tells you what it needs to be healthy. If it says at 8:30 at night, I'm tired, that is not the time to tell your body. It's like, well, you may be tired, but we're going out dancing. And it's like, okay, your body will go along with the gag, but there will be a price to pay. The bill always comes due. And when it says, wow, salad looks really good, and the other part of your brain says, yeah, but there's cake over there. I like cake. Yeah, can we do salad first? So listen to your body and cooperate with it in achieving the kind of health. Then the third thing is exercise to the extent that you're capable of doing that. I don't know. There has to be 6. Then the other thing is to be grateful. Even when something happens that is difficult, every injury, every illness, every surgery I've ever had, they're inconvenient, but there was something to learn from every one. No person gets out of this life alive. I have never met a person who gets out of this life without some injury or disruption in daily activity or some illness. That's just part of the human condition. You can't avoid the injuries or illnesses. Well, not really. I mean, things happen. We don't get to choose all the time. The only thing you can choose is your response. So
yes,
keep going till you find someone who can help you. Listen to your body when it says what you need to recover, and find the lesson in it. What do you need to learn from that injury or illness? Do you learn compassion? Do you learn patience? Do you learn not to do that again, right? There's always a lesson there. And then ultimately you end up on the other side of it with something to be grateful for. Well, I still have this limp or this body part that doesn't work right, but I'm a lot smarter than I was, and I'm more kind than I was, and I'm more thoughtful than I was. So it had ended up being a good thing. I found out that people care for me, and now I can go back to my life and be productive and healthy, and that thing ended up being helpful. So I guess there's 6.
Thank you very much for the 6 advices, and thank you for having you here in Frankfurt at Time Waiver Conference. And I really hope we can see each other in Romania.
I will look forward to being there. Thank you for the invitation.
Thank you.